Order. The House will come to order. For what purpose does the gentleman from Pennsylvania rise?
Mr. Speaker, I ask unanimous consent that all members may have 5 legislative days to revise and extend their remarks on the legislation and to insert extraneous material on the bill.
Without objection. Pursuant to House Resolution 219 and Rule 18, the Chair declares the House and the Committee of the Whole on the State of the Union for consideration of H.R. 1217. The Chair appoints the gentleman from Texas, Mr. Conaway, to preside over the Committee of the Whole.
Committee will come to order. Members will clear the well in the aisles. Take your conversations off the floor. Members will take their seats. The House will come to order. Members will please take their conversations off the floor. The House will come to order. The committee will come to order. The House is in the Committee of the Whole House, State of the Union, for the consideration of H.R. 1217, which the clerk will report by title.
A bill to repeal the Prevention and Public Health Fund.
Pursuant to the rule, the bill is considered read the first time. The gentleman from Pennsylvania, Mr. Pitts, and the gentleman from New Jersey, Mr. Pallone, will each control 30 minutes. The Chair recognizes the gentleman from Pennsylvania.
Thank you, Mr. Chairman. I yield myself such time as I may consume.
The gentleman is recognized.
Section 4002 of PPACA establishes a Prevention and Public Health Fund, which my bill, H.R. 1217, would repeal. The section authorizes the appropriation of and appropriates to the fund from the Treasury the following amounts: $500 million for FY 2010, $750 million for FY 2011, $1 billion for FY 2012, $1.25 billion for FY 2013, $1.5 billion for FY 2014, and for FY 2015 and every fiscal year thereafter, $2 billion. The Secretary of Health and Human Services has the full authority to use this account to fund any programs or activities under the Public Health Service Act that she chooses, without congressional input, approval, or oversight. HHS has already made disbursements from the fund, spending $500 million last year, and she has $750 million available for her to spend this year to fund prevention activities, the nation's public health infrastructure, workforce expansion, increasing immunizations, and preventing a variety of diseases. The goals of some of these disbursements are laudable, but we must remember that this funding is over and above the amount that Congress has already authorized and appropriated for these activities. There have also been questionable projects that have been financed with these funds, including placing signs directing people to bike paths. When Secretary Sebelius testified before my subcommittee, I asked her whether she needed further congressional approval to spend the money from the Section 4002 fund, and she answered no. I then asked her if she could fund activities above and beyond the level Congress appropriated, and she stated yes. This should concern every member that we have created a slush fund that the Secretary can spend from without any congressional oversight or approval. No one here can tell us how this funding will be used next year or 5 or 10 or 20 or 50 years from now. We can't predict how the money will be spent, and worse, we can't even influence it. I would suggest to my colleagues that if you wanted more funding to go towards smoking cessation or any other program, the health care law should have contained an explicit authorization, because you're not guaranteed that a dime of the money in this fund will go to your particular activity. By eliminating this fund, we're not cutting any specific program or activity. I'm not against prevention and wellness. This is not what this is about. This is about reclaiming our oversight role of how federal tax dollars should be used. I urge support for my bill, H.R. 1217, and I reserve the balance of my time.
The gentleman reserves the balance of his time. The gentleman from New Jersey is recognized.
Thank you, Mr. Chairman. I yield now 3 minutes to the ranking member of the Energy and Commerce Committee.
Yield me 2.
2 minutes to Mr. Waxman.
The gentleman is recognized for 2 minutes.
Mr. Chairman, this bill represents the Republicans' newest line of attack to disrupt, dismantle, and ultimately destroy the Affordable Care Act. Today, they are doing so by sacrificing a long-standing bipartisan policy to push a narrow partisan ideology. For many years, Republicans have joined with Democrats in supporting programs to prevent disease and promote health, and in turn to cut health care costs. But today, the House will vote to end funding for the first and only federal program with dedicated, ongoing resources designed to make us a healthier nation. Every state in the nation is already benefiting from the resources made available from the fund to fight chronic and costly conditions such as obesity, heart disease, and diabetes. Repealing the Prevention Fund is a blow against seniors. In states like California, Michigan, Iowa, Maine, North Carolina, and Massachusetts, they're using these funds to train personal home care aides who assist the elderly with Alzheimer's disease and other disabling conditions. Terminating the Prevention Fund is not only extremely short-sighted, it will also prove to be fiscally irresponsible. The return on this kind of upfront investment, targeted resources to help keep people healthy for as long as possible, will over time save precious health care dollars. We need to preserve the Prevention Fund because it can serve as a cornerstone for a health care system that finally recognizes that preventing illness is as important as treating them. Until now, prevention has too often been just a mere afterthought. American families support prevention. They want programs to educate seniors to use preventive health services such as mammograms and colonoscopies that can help extend their lives. And they want programs to focus on preventing childhood obesity and diabetes that will help their children to grow up healthy and strong. The American people want us to start working together to solve the real problems facing our nation. I urge my colleagues to oppose this partisan and divisive legislation, and I yield back the balance of my time.
The gentleman's time has expired. The gentleman from Pennsylvania is recognized.
Mr. Chairman, I, at this time, yield 3 minutes to the distinguished Vice Chairman of the subcommittee, the gentleman from Texas, Dr. Burgess.
The gentleman from Texas is recognized for 3 minutes.
I thank the Chairman for yielding. Mr. Speaker, I do rise today in support of H.R. 1217, the bill that, as we've already heard, repeals the Public Health Slush Fund that was included in the Patient Protection Affordable Care Act, passed just a little over a year ago. This fund, called the Public Health Fund, is almost $18 billion that accounts for the next 8 fiscal years, and the Secretary of Health and Human Services gets to spend this money on any program that he or she deems worthy. The money, what the money will be used for and how it will be used, essentially is an unknown. Neither this Congress nor subsequent Congresses have any earthly idea, and it is yet once again an abdication of our authority here in the United States Congress, an abdication of power in deference to the executive branch. And if that's what people think we were sent here to do, to simply carve off greater and greater pieces of our authority and hand it over to the White House, I hope that I'm wrong in that, but it seems like over and over again with the health care bill, with the financial reg bill, it seems like that is the mantra here. It does put way too much discretion in the hands of the Secretary of the Department of Health and Human Services. You know, we've got a predicted shortfall in the nation's health care provider workforce. Some of this money is going to go for scholarships, but it sets up a big problem. Under the Public Health Fund, some of those same students could receive a scholarship for 1 year, only to find that the Secretary has bigger and better things to spend it on next year. Maybe there's a new bike path that needs a sign, and that student would find their education unfunded because all of the discretion rests with the Secretary. Now, just a moment ago, the ranking member of the full committee stood up and said that it seems like all the Republicans want to do is defund and remove the Affordable Care Act. Well, I appreciate him noticing, because, Mr. Speaker, that is what the election of November 2nd, 2010 was all about. We were elected to come here and do that work for the American people. And the duplication contained within this slush fund. The ranking member spoke about smoking cessation. That's a good idea. I believe in that. I lost 2 parents to tobacco-related illness. But wait a minute, what about the duplication? When the ranking member was chairman last year, last Congress, he created the Center for Tobacco Products at the Food and Drug Administration. We funded that lavishly with a brand new tax. And now we're going to come back and fund it yet again with this public health slush fund? The ranking member asked about what programs we wanted to cut. Really, it's a question of, do we want to be accountable to the American people who elected us here to do this job? They sent us here to ensure that their money was being spent responsibly and that every penny would be accounted for and justified before being spent. With the current state of the economy, Mr. Speaker, I'm not sure how the American people feel about the Secretary choosing to spend money on signs to direct people to bike paths. I know how they would feel about it in my district. If I could have an additional 30 seconds, Mr. Chairman.
I yield the gentleman additional 30 seconds.
The gentleman is recognized 30 seconds.
In this law that was signed in the East Room of the White House just a little over a year ago, Section 4002 takes from Congress the oversight of spending, and it becomes a blank check for the Secretary to do with as she wishes without any other input from Congress. By doing that, it takes that authority away from the American people, because we are the closest contact the American people have with their federal government. And by taking us out of the equation, guess what, Madam Secretary? You got a blank check. It's all yours. I yield back.
Gentleman yields back. The gentleman from New Jersey is recognized.
Thank you, Mr. Chairman. I yield now 2 minutes to the gentlewoman from California, Ms. Capps.
The gentleman from California is recognized for 2 minutes.
I thank the ranking member of my subcommittee for yielding me time. Mr. Chairman, I rise in strong opposition to H.R. 1217, a bill that would defund a key strategic investment in our nation's long-term fiscal and physical. Simply put, this fund is a critical effort to make our nation healthier and in turn to bring down health care costs. This misguided bill would return our nation to a system of sick care, a system that hasn't worked, rather than one focused on health and wellness. That's something we can't afford to do. We all know that health care costs are rising at an unsustainable rate. In fact, the Republican majority has cited these costs as a reason to propose ending Medicare as we know it, by turning it into a voucher program, and by whacking away at poor people's health care, by block granting Medicaid. But one of the key drivers in entitlement spending is growth is chronic disease, the exact problem addressed by this prevention fund. Yet this bill short-sightedly cuts back our efforts to reduce chronic illness and promote wellness programs. In California, we are putting these funds to work to slow the alarming rise in obesity rates, to train our next generation of public health professionals, to curb tobacco use and improve our capacity to respond to disease outbreaks. At a time when counties have laid off thousands and struggle to maintain essential public health services, the need for this fund becomes even more critical. And that's why numerous local governments and national organizations, including the National Association of Counties and the American Public Health Association, oppose this short-sighted bill. Furthermore, the fund is a sound investment. Trust for America's Health Research has shown that investments in proven community-based programs to increase physical activity, to improve nutrition, and to prevent tobacco use could save the country more than $16 billion annually within 5 years. This is a return of over $5 for every dollar invested. Not only do these programs add to our constituents' quality of life, but it can also increase their economic output by keeping them healthy and in the workforce. These are some of the reasons I stand with these folks and urge a no vote, and I yield back.
Gentleman from Pennsylvania is recognized.
Mr. Speaker, at this time I yield 3 minutes to the gentlelady from Tennessee, Ms. Blackburn, who's on the Health Subcommittee.
Gentlelady from Tennessee is recognized for 3 minutes.
Thank you, Mr. Speaker, and I do rise in support of H.R. 1217. I think this is an important bill for us to bring forward, and I want to thank the chairman for bringing it forward and for helping to lead this Congress in the repeal of Obamacare. It is a message that the American people sent loud and clear last November. They do not want to see government coming in and controlling their health care choices. That is something that should be made by individuals, their family members, and their physicians, and not by the federal government. I have found it so interesting as we've been through the hearings on this and through the markups that we continue to hear, well, this $17.75 billion, well, it's just not that much money. Isn't that amazing? That in the middle of a CR crisis, a debt crisis, that we're hearing such rhetoric? I think it is amazing that we are being told, and through what we know, yes, and some of us did read the bill, and so we do know what was in that bill, that the Secretary can spend this however she wants to. She does not have to come back to Congress another time to get permission for spending this slush fund. And isn't it amazing that some of our colleagues think that a fund will make people healthier? Money doesn't make people healthier. We all know that. And isn't it amazing that in the middle of all of this, we are out of money at the federal level, we all know that the cost of health care is rising, and we know that one of the reasons that the cost of health care has risen so much in the last few years is government intervention. Those are some of the known components that we have. I think it's important to realize, too, Mr. Speaker, eliminating the slush fund does not cut any specific program. And proponents of this fund want to claim that we're cutting. What we're doing is saying, no, you can't allow the Secretary to have control and just give it out. This needs to go through the normal, regular funding processes. That is very important, and it's time that we realize we have to do that. Yes, let's move forward. Yes, let's repeal Obamacare. Yes, let's get it off the books. Let's do everything we can to get the federal government out of your pocket, out of the middle of your health care decisions. Let's make certain that those choices go to individuals and to their physicians, and that they are not going to be dictated by the Secretary of Health and Human Services, who has a slush fund of $17.75 billion to spend as they see fit over the next 10 years. We need to be changing the way health care is going to work, and we need to do it with putting individuals in charge. I yield back.
Yields back. The gentleman from New Jersey.
Mr. Chairman, I yield now 2 minutes to the gentlewoman from Illinois, Ms. Schakowsky.
Gentlewoman is recognized for 2 minutes.
Here they go again. The Republicans failed in their efforts to repeal the Affordable Care Act, and now they're reversing course and trying to cripple implementation by attacking individual provisions of the law. The United States has a health care system designed to treat the sick, not to prevent disease from occurring in the first place. The Prevention and Public Health Fund is a crucial component of the health reform law's effort to remedy that weakness and transform today's sick care system into a prevention-focused health system. The Prevention and Public Health Fund will avert future illness, save lives, and restrain the rate of growth of health care costs. It's a dedicated investment in community prevention and is a much-needed down payment on the health and economic well-being of all Americans. Federal investments from the Prevention and Public Health Fund have already begun to address improvements in the nation's health status by supporting essential and proven prevention activities such as immunization, and tobacco cessation. The Prevention and Public Health Fund holds great promise to improve the capacities of state and local health departments to protect communities from health threats through the use of technology. It will increase numbers of highly skilled scientists and other public health professionals. I want to be very clear, and you've heard it yourselves, this is simply another attempt by Republicans to defund the Affordable Care Act and stop its implementation. I urge my colleagues to vote against this bill to repeal the Prevention and Public Health Fund. And I yield back.
The lady yields back. The gentleman from Pennsylvania.
Mr. Speaker, the gentlelady kept saying it will, it will, it will. The simple fact is we don't know where the money's going to go. I yield 3 minutes to the distinguished gentleman from Georgia, Dr. Gingrey, who is a member of the subcommittee.
The gentleman is recognized for 3 minutes.
Mr. Speaker, I thank my chairman for yielding. At least some members of this body can remember ads back years ago touting the miraculous benefits of Sal Hepatica and Carter's Little Liver Pills. Probably all of the members can remember, because it was just a year ago, Andy Griffith touting the new health care reform bill. And those of us who are on Medicare remember getting those glossy mail-outs, very expensive, slick-looking ads really touting the benefits that Obamacare has brought to Medicare, even though the new bill, the new entitlement creation took something like $550 billion out of Medicare, and yet they had the audacity to send these ads out, these flyers saying that it improved Medicare. Obamacare improves Medicare. Go figure. Well, that's a concern here. That's why I'm standing in strong support of Chairman Pitts' bill, H.R. 1217. The Prevention and Public Health Fund is established under Patient Protection Affordable Care Act, Obamacare, for prevention, wellness, and public health activities authorized in the Public Health Service Act and administered by Secretary Sebelius, the Secretary of Health and Human Services. But she can use those funds in any way she deems appropriate, as long as she says it's for public health. Can it pay for political TV advertising for President Obama ahead of the 2012 elections? Absolutely she could. Nothing could stop her. The Congress couldn't, as long as she deems it is necessary for public health. Pay for thousands of signs in communities all across the country declaring that PAPACA is a success? Nothing would stop this secretary or any secretary from doing so, as long as they call it for public health. Not even Congress. And as the chairman said, Mr. Speaker, the amount of almost $18 billion is just a first down payment, if you will, because in perpetuity, $2 billion a year continues to be appropriated. And you do that with a bill that, quite honestly, this member thinks will be declared within a year and a half, hopefully sooner, unconstitutional. So we're spending money that's absolutely unnecessary at a time when we're, sitting here with $14 trillion worth of debt and listening to the Secretary of Treasury say within 6 weeks we're going to have to raise the debt ceiling so we can borrow more money. And here we're spending $17 billion with a B, and that's not just chump change by any stretch of the imagination. Last year, in 2010, the CDC actually spent some of $500 million to promote increasing the excise tax on tobacco to the states, basically saying to the states, you need to make sure you raise taxes on tobacco because it's for a health purpose. Can I have 15 more seconds?
The chair yields 30 seconds, gentlemen.
Gentleman recognized additional 30 seconds.
Mr. Chairman, thank you, and I thank the chairman for yielding. And let me just conclude that clearly this is a necessary bill to let Congress once again have the opportunity to control spending. That is our responsibility. That is our constitutional right. That's what the American people want, and I think the chairman is absolutely right with this bill, and I fully support it. Urge all my colleagues to do as well, and I yield back.
Chairman yields back. The gentleman from New Jersey.
Thank you, Mr. Chairman. I yield now a minute and a half to the ranking Democrat on the Labor Health Appropriations Subcommittee, Mr. Lauro.
Chair is recognized for a minute and a half.
I urge my colleagues to vote against this resolution. It will cost money and endanger the health of the American people. We included the Prevention and Public Health Fund in the Affordable Care Act because we know preventive health care reduces health care costs. It dramatically increases Americans' quality of life. Preventable causes of death, such as tobacco smoking, poor diet, and physical inactivity, the misuse of alcohol, have been estimated to be responsible for 900,000 deaths annually, nearly 40% of total yearly mortality in the United States. Further, 7 in 10 deaths in America are from chronic diseases, and by 2020, the U.S. may spend $685 billion a year on these chronic diseases. This fund works to bring down these numbers and to help Americans live longer, healthier lives. Preventive care is fiscally responsible. One example would be impacted by this misguided legislation is vaccines. Estimates indicate that we save up to $400 for every illness averted by vaccination, and that does not even take into account the costs of further transmission in the case of serious public health epidemics. By supporting our public health workforce, building health infrastructure, by promoting exercise, reducing tobacco use, the Prevention and Public Health Fund will go a long way towards reducing the surging costs of health care for American families and for our nation. It is short-sighted folly to repeal this fund now, especially when you consider all the oil subsidies and breaks for corporate lobbyists that the majority has included in their budget. We should not be putting political ideology before public health like this. I urge my colleagues to oppose this resolution.
Gentleman from Pennsylvania is recognized.
This time I yield 2 minutes to the gentleman from New Jersey, Mr. Lance, member of the subcommittee.
Gentleman is recognized for 2 minutes.
Thank you, Mr. Speaker. I rise today in support of H.R. 1217. As members of the Energy and Commerce Health Subcommittee, my colleagues and I have participated in a number of hearings that have explored the fiscal impact of the new health care law. These hearings have revealed the existence of several programs and mandatory spending provisions contained in the law. Health and Human Services Secretary Sebelius said during testimony that she had sole discretion over billions of dollars in direct, unlimited, mandatory spending under the law. This means that without any congressional hearings, without any language in appropriations bills, and without any oversight, the executive branch has been granted unprecedented spending authority. Today's legislation, H.R. 1217, will repeal one of those little-known programs called the Prevention and Public Health Fund and subject it to the annual appropriations process. The aim may be worthy, Mr. Speaker, but this should be subjected to the annual appropriations process. This action, according to the Congressional Budget Office, will save American taxpayers $16 billion over the next 10 years. Mr. Speaker, as we all know, the federal government is $14 trillion in debt. Our deficit for this year will be at least $1.5 trillion. We must get federal spending under control. We can start by repealing programs that run afoul of congressional oversight. I urge members to support H.R. 1217, and I yield back the balance of my time.
Chairman yields back the balance of time. Who seeks recognition? Gentleman from New Jersey.
Mr. Chairman, I yield 2 minutes to the gentlewoman from Colorado, Ms. DeGette.
Gentleman from Colorado is recognized for 2 minutes.
Thank you very much, Mr. Chairman. I'm frankly stunned to have to come to the House floor today to talk about a bill that defunds the largest investment we've ever made in our population's health, the Prevention and Public Health Trust Fund. The trust fund specifically says what it's going to be used for: reducing tobacco use, expanding opportunities for recreation and exercise, bringing healthier foods like fruit and vegetables to communities in need, and helping kids to eat healthier meals in schools. All of us who have been involved in health issues for many years know that the biggest public health epidemic that we have right now is obesity. And if we don't do anything to reverse these trends, then for our children and our children's children, we are not going to have good outcomes. 75% of all health care costs are spent on the treatment of chronic diseases, many of them preventable. Our nation's youth are confronting unprecedented levels of obesity, placing them at ever-increasing risk for those very same chronic health conditions. I think it's pathetic that we have children in this country who only have access to playgrounds at McDonald's, when we only have 8,000 playgrounds in this country. And so what this trust fund does is it supports research that examines evidence-based practices relating to prevention, including the translation of interventions from academic settings to real-world settings. This is not, as the opponents of this trust fund say, a slush fund or something that is simply willy-nilly spending. Instead, what it is, it's evidence-based, and it's looking at ways that we can prevent childhood obesity and nutrition, reduce tobacco use, and expand opportunities for recreation and exercise. This is something all of us can get behind. This is something we should all support, and I'm sorry that it's become caught up in this partisan web because, frankly, we should all support this for our kids. And with that, I yield back.
Gentlelady's time expired. Gentleman from Pennsylvania is recognized.
Mr. Speaker, I have the copy of the law the gentlelady referred to. She says the trust fund refers to spending for fresh food and vegetables and other things. There's none of that in the language. I would welcome her to point it out. I reserve the balance of my time.
Gentleman reserves. Gentleman from New Jersey, seek time.
I yield 1.5 minutes to the gentlewoman from California, Ms. Lucille Rowe-Allen.
Gentlelady from California is recognized for 1.5 minutes.
Mr. Speaker, H.R. 1217 is an attack on public health and disease prevention in this country. The Prevention Fund is our first national proactive strategic commitment to changing the focus of our health care system from one of treatment to one of keeping Americans healthy. This change in focus is essential because keeping people healthy improves the quality of their lives and that of their family, and it is our best means of controlling preventable chronic diseases, which account for 7 out of 10 deaths and 75% of our nation's annual health care costs, totaling $1.7 trillion. If H.R. 1217 passes, we lose a critical opportunity to control health care costs, and we lose the opportunity to reduce unnecessary suffering and death from preventable chronic diseases. Adding to the assault of H.R. 1217 on public health and prevention is the FY 2011 continuing resolution, which cuts CDC's budget by over $700 million. The result of these proposals is that millions of Americans will needlessly continue to suffer from preventable chronic diseases, costly treatments, and costly hospitalization. Prevention saves lives, and prevention saves money. Defeat H.R. 1217 and continue to build a healthier America. I yield back the balance of my time.
Gentlelady yields back. Gentleman from Pennsylvania.
I reserve the balance of my time.
Gentleman from Pennsylvania reserves. The gentleman from New Jersey.
Mr. Chairman, I yield 2 minutes to the gentlewoman from the Virgin Islands, Ms. Christensen.
Gentlelady is recognized for 2 minutes.
Thank you. Mr. Speaker and colleagues, I cannot believe that we are here debating a bill that would repeal the Prevention and Public Health Fund. At a time when we should be championing legislation to strengthen the health and well-being of Americans and this nation, my colleagues on the other side of the aisle are doing the exact opposite with H.R. 1217. Currently, we have tens of millions of hardworking Americans who suffer and some die from preventable diseases. And without prevention and public health efforts, the very services this fund was created to support, tens of millions more will be affected in the future. With so much at stake, and we're talking about human lives, we should not be here fighting about the merit and value of keeping the Prevention and Public Health Fund in place. We would do better for our country in terms of health and savings if we were instead discussing increasing it. If my colleagues on the other side of the aisle are not moved by the disastrous human impact, then perhaps they'll be moved by the equally disastrous economic impact that it will have, because not having prevention and an effective public health measures in place costs money, and a lot of it. On the other hand, the Journal of Health Affairs reported that increasing the use of proven preventive services from their current levels to 90% would result in $3.7 billion in savings in just 1 year. And we know from a Joint Center study that reducing health disparities, which this fund would help to do, could save as much as $1.24 trillion in direct and indirect medical costs in just a 3-year period. The bill to repeal the Prevention and Public Health Fund is not just misguided legislation, it is harmful and unjust, it is contrary to our values and a disrespect of the value of human life. It will not save money. In fact, it will cost this nation more, both in human health and wellness, as well as in actual health care spending. I strongly urge my colleagues to vote to protect all Americans and the moral standing of this country by voting no on H.R. 1217. I yield back the balance of my time.
The gentlelady yields back. The gentleman from Pennsylvania.
Mr. Speaker, can I ask how much time is remaining?
The gentleman from Pennsylvania still controls 15¼ minutes. The gentleman from New Jersey controls 17½ minutes.
How much?
17½.
17½. I continue to reserve.
Gentleman reserves. Gentleman from New Jersey.
Mr. Chairman, I yield myself such time as I may consume. Mr. Chairman, it's been 100 days of the Republicans' no jobs agenda, and they've chosen to devote time and energy to bills and resolutions that would defund the Affordable Care Act, eliminate mandatory support for preventive care, and abolish any and all federal support for Planned Parenthood. The House Republicans know that these measures won't be approved by the Senate and would never be signed by the President. It's just another political gesture at a time when we should be working to create jobs and promote economic recovery. Now, the bill on the floor this week, H.R. 1217, would abolish the Affordable Care Law's Prevention and Public Health Fund. This is the fund that prevents disease, that detects it early, that helps manage conditions before they become severe. All empirical data, all experience, and plain old common sense informs us that prevention and early treatment not only save lives, they also save money. In fact, the Prevention and Public Health Fund addresses one of the major deficiencies in our approach to health in America, and that's preventing illness before people get sick. The Republican assertion that mandatory funding, which I've heard over and over again today and also in the Health Subcommittee, that this is somehow mandatory funding and it's unprecedented, that's completely not true. Medicaid and Medicare are funded with mandatory support, and there are a lot of other programs within our committee's jurisdiction and in Congress in general that are funded through mandatory funding. So, you know, I don't know how many times I'm going to come to the floor and hear about repealing the health care reform. I understand tomorrow there's going to be an enrolled bill that goes along with the CR that's going to defund the whole Affordable Care Act. So I don't know. Here today we're going to defund one piece, the Prevention Fund. Tomorrow we've got another enrollment resolution that defunds the whole bill. Planned Parenthood, again, another resolution tomorrow to defund Planned Parenthood. How many times are we going to keep voting on the same thing over and over and over again? Meanwhile, I don't see a single piece of legislation coming to this floor that addresses jobs or the economy. When I go home, people want to know what we're doing about the economy. They know that the health care reform is passed. They're benefiting from it. It's gradually unfolding before them. They don't want us to continue to debate the same thing over and over again, repeal, defund, and no suggestion about what you would do to replace it either, by the way. But I reserve the balance of my time.
I reserve the balance of his time. The gentleman from Pennsylvania.
Madam Speaker, I'm prepared to close. Could I ask the other gentleman how many speakers he has left?
Actually, I do have a few more speakers, and I see that the gentlewoman from Texas is here. I would yield her 1 minute to Ms. Sheila Jackson.
I'll reserve the balance of my time.
Gentleman from Pennsylvania reserves the balance of his time. Gentlewoman from Texas is recognized for how many minutes? 1 minute.
Madam Chairman.
Gentlewoman's recognized for 2 minutes.
Let me thank the distinguished gentleman from New Jersey, and let me thank the chairman of the committee as well. Madam Chairwoman, we just have a disagreement, and I would venture to say that the bulk of sick people in America and others who every day struggle to maintain their health so they can provide for their families would vigorously disagree as well. I think there are 2 points that I'd like to make, is that what we lose when we repeal this Affordable Care Act and the funding of it is more than the glory that we get from going home and bragging that we have undermined America's health care system, or as some would say, that we have taken away Obamacare. Preventative care is an unbelievable plus that this bill has generated. I went to one of my emergency centers, a new one that is crafted under the public health system. It is to take off the load of the emergency centers or the emergency centers that ambulances go to. What an amazing sight of people coming with broken toes and fingers and feet and bruises and maybe the beginning of heart disease and other problems. But it was a lower level emergency room, not particularly preventative care, but the kind of intervention that saves millions of dollars. I want to go even lower than that, and I don't use that terminology. But I want people to be able to go and check on their cholesterol, check on their high blood pressure, understand whether they have sickness, or understand what stages of heart disease that they're in a preventative care cycle. And everyone knows that economists document how many billions of dollars that will serve. How can we vote against that? And then secondarily, there are 2 elements that this bill or the Affordable Care Act provides as being repealed. Research and training for health professionals that we absolutely need, whether you're in the private care system or not. And then, of course, protecting our most precious resource, and that is our children. If you can raise a child in a healthy manner, both in terms of nutrition, in terms of immunization, in terms of regular doctor visits, then you are able to save billions of dollars. This is wrong-headed and a wrong direction. Many of us are fasting. I said on this floor, we must pray, because this is the wrong direction to go. With that, Madam Chairwoman, I yield back.
The gentlewoman's time has expired. The gentleman from New Jersey.
I yield myself again such time as I may consume.
Gentleman's recognized.
Madam Chairwoman. Madam Chairman, we're simply never going to bend the cost curve on health care or improve America's quality of life until we focus much more on disease prevention. And that's what this prevention fund is for. I always thought that both Democrats and Republicans wanted to keep people out of the hospital, off of disability, leading productive lives, and trying to prevent diseases before they occur. I never thought that this was a partisan issue, because we need to have a system of well care, not sick care, if we're really going to have success in saving money and bending the cost curve. So I don't understand what my Republican colleagues, who so many times in the committee would talk about prevention, but all of a sudden now they want to abolish the prevention fund. It just doesn't make any sense. Before the Affordable Care Act, prevention activities were chronically underfunded, accounting for only 2 to 4% of the national health care expenditure by some estimates. Considering that chronic diseases eat up estimated 75% of our $2 trillion in annual health care spending, to spend an additional $2 billion for wellness and prevention is a wise investment. Since the Affordable Care Act was enacted, every state has benefited from the Prevention and Wellness Fund. This year, over $750 million in grants were dispersed, building on a $500 million investment last year, and repealing this program would mean putting the brakes on investments that are already beginning to make a difference. In my home state of New Jersey, many of my constituents have benefited from over $15 million in prevention and public health grants, funding for such things as HIV prevention, tobacco cessation, mental health care, critical public health infrastructure improvements, as well as support for primary care training and workforce development. I could do the same. I have a sheet here. I'm not going to read it, but I have a similar sheet for Mr. Pitts and Dr. Burgess and others on the Republican side who specified these are the types of grants that are being made available in their states. And I simply don't understand. There are 600 national, state, and local organizations supporting the fund as a primary vehicle for making public health investments that would create jobs and help lower long-term health care costs. The committee has, the Energy Energy and Commerce Committee and the Health Subcommittee have heard me many times say that we can never calculate the huge savings that come from prevention. We had the CBO in the other day, and I said to the CBO, why don't you calculate prevention? Because we would save trillions of dollars. Well, they don't do it. But the bottom line is we all know that prevention saves money. If you concentrate just on chronic diseases, this law helps move the nation from a focus on sickness and disease to one based on wellness and prevention. And if you take away this critical new investment in prevention, it's going to be harmful to the health of Americans now and also in the future. I reserve my time.
Gentleman reserves balance of his time. Gentleman from Pennsylvania.
Madam Speaker, I'm prepared to close, so I reserve the balance of my
Gentleman
time.
reserves the balance of his time. Gentleman from New Jersey.
Yes, I would also, I mean, I'm prepared to close. I'll reserve, but I'm prepared to close.
You go first.
Gentleman from New Jersey. Does he close first?
Madam Chairman, it was my understanding that I get to close. I don't want to, could we check that, or?
Pennsylvania has the right to close.
He has the right to close? All right. Let me yield myself such time as I may consume. You know, Madam Chairwoman, and I'll address this directly to my Republican colleagues, in the last few weeks when we had hearings in the Health Subcommittee on the various measures that the Republicans wanted to defund, and I know they want to repeal the whole bill, and I know they want to defund everything, and that's what they're going to try to do again tomorrow. I understand all that. I totally disagree with it, but I understand that they're against the Affordable Care Act. They want to defund it. They want to do whatever they can to get rid of it. But it just seems to me that to pick the one bill or the one fund that deals with prevention is really the worst thing you could have done today, because what we're trying to do with the Affordable Care Act, and what I've sought to do in everything that we've done in the subcommittee since I've been on it, is to really stress prevention. Because we can avoid people from going to hospitals, we can avoid people from going to nursing homes, they can lead a better quality of life, and we save money. So I just think it's really unfortunate today that after so many years of a bipartisan effort to deal with prevention, to fund prevention issues, that this is the one bill, the one fund that's actually picked on today to come to the floor. I think it's really a horrible thing that that's the case, and so I would urge my colleagues to vote against this resolution, because if you really believe in prevention, if you really believe that we can make a difference in making people well and preventing them from getting sick, then you should vote against this bill. I yield back, Madam Chairwoman.
Gentleman yields back. Gentleman from Pennsylvania.
Thank you, Madam Chair. Madam Chair, it's time for a fiscal reality check. The federal government is now borrowing 42 cents of every dollar it spends. Washington is spending more than one of every $4 this country produces, and we are facing a third straight year with $1 trillion deficit. Yet, when the subcommittee voted on this straightforward bill to strip billions in unaccountable spending from the health care law based on the simple premise that Congress should fund prevention and wellness activities by prioritizing them in the regular annual spending process, the response from the other side of the aisle was to say, we're not broke. Madam Chair, I beg to differ. Our debate today is not about the virtue of preventive health care and wellness programs. I support prevention. The real question is whether our nation can afford to authorize the Secretary of Health and Human Services to spend nearly $18 billion over and above what Congress appropriates over the next decade on programs of the administration's choosing. H.R. 1217 does not cut a single program because this fund does not guarantee funding for any particular program. Every member who supports this fund on the assumption that it provides additional money for a project they deem worthy should understand that no one knows where this money will be spent. Perhaps it could be used to combat obesity or for cancer screenings, or perhaps it will be used to post signs about the location of bike paths. The point is, Congress abdicates our authority and responsibility for investing in prevention by handing a perpetual blank check to the Secretary. Governing and solving our fiscal problems is difficult. It requires hard choices. It is easy to spend. The easy choice was to assign mandatory advanced appropriations to these initiatives, rather than making them a budget priority. But it's only easy until the bill is due and the credit card is maxed out. Well, the bill is due and the credit card limit is approaching fast. Congress needs to reassert its role and set spending priorities rather than give the executive branch unfettered power to spend as it wishes. I urge my colleagues to support the bill, and Madam Chair, I yield back.
Gentleman yields back. All time for general debate has expired. Pursuant to the rule, the bill shall be considered read for amendment under the 5-minute rule. No amendment to the bill is in order except those printed in House Report 11261. Each such amendment may be offered only in the order printed in the report by a member designated in the report, shall be considered read, shall be debatable for the time specified in the report, equally divided and controlled by the proponent and an opponent of the amendment, shall not be subject to amendment, and shall not be subject to a demand for division of the question. It is now in order to consider amendment number 1 printed in House Report 11261. For what purpose does the gentlewoman from Texas rise? Clerk will designate the amendment.
Amendment number 1, printed in House Report number 112-61, offered by Ms. Jackson Lee of Texas.
Pursuant to House Resolution 219, the gentlewoman from Texas, Ms. Jackson Lee, and a member opposed, each will control 5 minutes. Chair now recognizes the gentlewoman from Texas.
Thank you, Madam Speaker. I know sometimes in the rush of legislating, many members are faced with any number of challenges in understanding legislation, but I do know that the majority has come with their own roadmap. And I do want to respect the different viewpoints, and I don't say this in any way to malign. First of all, I'm grateful that this amendment was made in order, but I wish it wasn't, because I understand that all legislation that passes needs to have, in fact, or often has those who agree with it and those that do not. And that's fair enough. And the process that we usually use to handle that is to amend, not repeal. There are some subsections here that I've looked at and have concern with, and many have heard me on the floor of the House discussing a number of issues regarding my local hospitals. But I will say to you that the repeal of this bill is putting us on the road to ruin. And my amendment is simple. It asks the HHS to place on its website the monies rescinded so that the American people can see. For some, it may be to see the great success of taking away money. For others, it may be to see what has happened to the resources that they need to take care of themselves. Very quickly, this amendment requires for fiscal year 2010, 2011, 2012, 2013, 2014 to list the amount of money that is being taken away from good health care. But also, Madam Speaker, it will also hopefully point people to what they're losing. For example, look at this beautiful baby here. We will not have, under the repeal of this Affordable Care Act, the bounty of preventative care for those with chronic diseases. Americans who are subject to chronic disease such as heart disease, cancer, stroke, and diabetes, their only care will be the emergency room, high-priced emergency room, when they're in a diabetic coma, or they're in a stroke, or they have a heart attack, rather than being able to go to their doctors. But we start early on with this little baby being able to go to wellness clinics or to their community health clinics. That's what the money that is being rescinded is going to do to you. In addition, you will find that chronic diseases resulted in $75.3 billion loss in productivity in the state of Texas alone. This is going to be across America. The rescissions will also impact all of the states. I have a list of almost 50 states that have begun to receive dollars from the Affordable Care Act, from Alabama to Alaska to Pennsylvania to Massachusetts to Michigan to Rhode Island and South Carolina and Tennessee and Texas, all of the states that my good friends come from. They are receiving money right now. In addition to this issue of taking away money, Prevention for Healthy America concluded that investing $10 per person per year in proven community-based programs that increase physical activity, for example, improve nutrition and prevent smoking and other tobacco could save the country more than $16 billion annually within 5 years. When you see how much money was taken away, just realize that you multiply that. If it's a total of $16 billion, you're going to lose $16 billion a year because there will not be any wellness program. Community and clinical prevention, which is about $2 million. And so you will take away money from HIV prevention, and that is a very costly proposal. You'll take away from public health infrastructure. You'll take away from primary care residency expansion program, training residents and doctors. You'll take away from other medical assistance programs, expansion of physician assistant training. You'll take away from public health departments where they link people to need health care. You'll take away childhood and adult immunizations and protecting water we drink, the food we eat. Let me just say to you that my amendment is to shine the light on what will be happening to the health care of Americans. I want my colleagues to tell their constituents, not those that are already focused on negative aspects of what we're trying to do here, but those who are just simply hardworking mothers and fathers who are trying to make a living and who need this health care. I reserve my time.
Gentlewoman's time has expired. Does the gentleman from Pennsylvania rise in opposition to the amendment?
At this point, yes.
Gentleman's recognized for 5 minutes.
Thank you, Madam Chair. I might just mention to the lady all the wonderful programs she mentioned are not mentioned in this section of the law. There's no guarantee that this money will be spent for any of that. H.R. 1217 repeals the Prevention and Public Health Fund and rescinds unobligated balances. The Jackson-Lee Amendment would require the Secretary of Health and Human Services to post on the HHS public website a notice of the rescission of unobligated balances of the Prevention and Public Health Fund and the amount of the rescission. I support transparency in government. I actually wish there was more transparency in how HHS has already spent the money from this fund. The lack of transparency and accountability regarding this fund is a primary reason I support H.R. 1217. And if the author feels this would increase transparency, then I support the amendment. I yield back.
Gentleman yields back. All time has expired. The question is on the amendment offered by the gentlewoman from Texas. Those in favor say aye. Those opposed say no. In the opinion of the chair, the ayes have it. The amendment is agreed to. It's now in order to consider amendments number 2 and 3 printed in House Report 11261. For what purpose does the gentlewoman from Florida rise?
Good afternoon, Madam Chair. I have an amendment at the desk.
The clerk will designate the amendments.
Amendment number 2, printed in House Report number 112-61, offered by Ms. Castor of Florida.
Pursuant to House Resolution 219, the gentlewoman from Florida, Ms. Castor, and a member opposed, each will control 5 minutes. The chair recognizes the gentlewoman from Florida.
Thank you, Madam Chair. Madam Chair, my amendment requires a government accountability study within 90 days of enactment of the law to study the impact the Prevention and Public Health Initiative has on preventing chronic diseases and promoting public health. Madam Chair, prevention works. It's smart. It saves the taxpayers money, it saves families money, and it saves lives. The Prevention and Public Health Initiative empowers communities all across this great nation to focus on prevention and wellness and what works for them when it comes to reducing cancer cases, reducing heart disease, reducing strokes back in our own hometowns. In Florida alone, there are over 10 million cases of the 7 most common chronic diseases: cancer, diabetes, heart disease, hypertension, stroke, mental disorders, and pulmonary conditions. We all know our neighbors, friends, families, folks we go to church with, folks we see in the grocery store that suffer from these diseases. And a lot of these cases, if they had gotten the early detection, or if we had worked harder on prevention, they wouldn't have fallen into that trap of the disease and all that it brings for families and communities. See, we have a better approach. Now, we're smarter in America. No longer should our health care system be focused only on taking care of folks in the hospital when they're sick or at the end stages. We're smarter. We can prevent a lot of this through education and being proactive and encouraging healthier lifestyles. And that's what the Prevention and Public Health Initiative does. State and local communities are able to decide what works best for them. This isn't Washington dictating what you should do. This is saying to our local hometowns and communities, what do you think works best for you? So I would encourage all of my colleagues to take a look at the grants that are being made. How are your local communities making these investments work in your own districts to invest in the long-term health of our neighbors and the economic prosperity of our communities? For example, in my hometown, in my district, the Pinellas County Health Department has brought together neighborhoods and all the nonprofits to determine, you know, what's going to work best in Pinellas County is encouraging healthier lifestyles, because we have an obesity epidemic. So they want to build sidewalks, trails, bike lanes, better lighting to encourage people to exercise. They're going to make improvements to parks so children have the opportunity to get out and play after school instead of sitting in front of the television. I also have a great public university, the University of South Florida in my district. They are training the modern healthcare workforce in Florida. These are professionals fighting on the front lines of our communities and, yes, creating jobs. This is creating jobs to encourage the healthier lifestyles that work. USF is able to identify where the gaps in training might be, develop updated curriculum to ensure the public health care workforce receives the most up-to-date research, and then they can spread the word throughout the churches, the grocery stores, and our neighborhoods. The Florida Department of Health is also using these grants and checking on all of our strategies statewide to determine what works. See, this is one of the important goals of the Affordable Care Act, to promote wellness and prevention, to ensure healthier outcomes for our families and neighbors. And the examples I've just shared with you are only a few of what's happening all across the country. We're smarter, Madam Chair. Prevention works. It saves taxpayers money, it saves families money, and it saves lives. I reserve the balance of my time.
Of our time.